If you are anything like me, you're a deeply curious learner. You love digging into a complex topic, peeling back the layers of information and just...
Finally getting that massive aha moment.
Yes, exactly. That moment where all the puzzle pieces just suddenly snap together. And that is the exact experience we are going to deliver to you today. We are going on a deep dive into this highly complex, absolutely fascinating drug called Bevacizumab.
Which you might also know by its brand name, Avastin.
Right, Avastin. Specifically, we're looking at its role in treating glioblastoma, or GBM. And knowing our listeners, you're likely already aware that GBM is the most prevalent and honestly the most aggressive, malignant primary brain tumor found in adults.
It really is.
So our mission for this deep dive is to understand something that almost sounds like science fiction. We want to figure out how a drug that can literally trick an advanced MRI machine might not actually cure the underlying disease, but can still completely transform a patient's quality of life.
It's a profound paradox in modern medicine. We are looking at a situation where the visual evidence we see on a scan and the clinical reality of the disease they do not always align.
Which is wild.
Yeah, it challenges everything we think we know about measuring success in cancer treatment.
It really does. So to get to the bottom of this, we have a massive stack of sources today. We are pulling from a foundational 2014 clinical review on antiangiogenic therapies, a brand new 2025 meta-analysis tracking the adverse effects of this specific drug.
Plus the active phase 3 clinical trial data coming out of Europe right now.
Yes, and the latest 2025 medical guidelines on brain tumors. But perhaps most importantly, we've got raw, real-world patient reviews from drugs.com to really ground all this heavy science in actual human experiences. Okay, let's unpack this, starting with the villain of our story, glioblastoma.
Right, so given that we are dealing with an incredibly aggressive pathology here, the standard of care is notoriously brutal. Treatment usually begins with a maximal safe surgical resection.
Which means they are trying to physically remove as much of the tumor burden as possible, right?
Exactly, without destroying healthy brain function in the process. And that surgery is immediately followed by a rigorous 6 weeks of concurrent radiation therapy alongside a chemotherapy drug called temozolomide.
And even after that grueling 6-week period, the patient just transitions right into even more temozolomide maintenance therapy.
Yeah. And despite throwing our most advanced medical weapons at it, the disease remains fundamentally incurable. The median overall survival with this aggressive standard treatment, it hovers around just 15 months.
Man, that timeline is just heartbreaking to think about, especially when you consider the physical toll the treatment takes on the patient. But when you look at the sheer amount of radiation and chemotherapy being deployed, it forces this major biological question.
How does the tumor survive it all?
Exactly. How does it sustain such rapid growth? Like, where is it getting the resources to survive and expand while under this constant medical attack?
Well, that brings us to a biological process called angiogenesis. Tumors are living tissue. And just like any healthy organ in your body, they require a constant supply of oxygen and nutrients to survive.
Right.
So when a glioblastoma mass reaches a certain size, typically just a few millimeters, the cells right in the center of the mass literally begin starving for blood.
They become hypoxic.
Exactly. Severely hypoxic. They are suffocating from a lack of oxygen. So to survive, the tumor hijacks the body's natural cardiovascular system. It actually begins growing its own dedicated network of blood vessels.
It essentially forces the surrounding healthy tissue to build a customized supply line directly into the heart of the tumor, which is terrifying. But if the tumor is starving and suffocating, how does it actually communicate with the rest of the body to get those new supply lines built? What's the signal it's sending out?
It flips a biological switch. It starts pumping out this signaling protein called VEGF, which stands for Vascular Endothelial Growth Factor. VEGF is basically the central mediator for new blood vessel formation.
And the numbers on this are crazy. Research shows that VEGF concentrations are 11-fold higher in grade 3 and 4 gliomas compared to lower grade tumor.
11-fold, yeah. The tumor is essentially flooding the local microenvironment with massive amounts of this chemical signal, just screaming at the surrounding endothelial cells to start dividing and building new vascular pipelines.
So we have this weapon designed to counter that, bevacizumab, but what actually is it and how does it operate inside the body to disrupt that signaling process?
So in clinical terms, bevacizumab is classified as a recombinant monoclonal anti-VEGF antibody.
Right, but if we break that down to its functional mechanics, it's essentially a highly sophisticated lab-engineered interceptor.
That's a great way to put it. When it's infused into the patient's bloodstream, these microscopic antibodies circulate until they encounter that specific VEGF protein.
And then it just locks on.
Exactly. The antibody binds perfectly to the VEGF molecule, neutralizing it before it can ever reach the receptors on the blood vessels.
Right.
So the tumor continues screaming for new supply lines, but bevacizumab intercepts the message in transit.
The signal never actually arrives.
Right, which leads to a really fascinating concept in the research called the normalization theory.
Oh, I love this part. Because the blood vessels built by the tumor are not normal, healthy human blood vessels at all.
Not even close.
Because they're constructed in such a frantic, chemically induced panic, their architecture is completely chaotic. They're disorganized, they're fragile, and highly leaky. The analogy used in the literature compares it to a house built by a terrible plumber, where the pipes are just bursting and water is constantly leaking behind the drywall.
Yeah, and that chaotic plumbing is incredibly detrimental to the patient, obviously, but also to the treatment process itself. The normalization theory suggests that when bevacizumab comes in and blocks those chaotic growth signals, it starves the weakest, most poorly constructed vessels,
Causing them to collapse and just prune away.
Exactly. What is left behind is a smaller but much more structurally sound vascular network. So by normalizing the plumbing, the theory posits that you can actually improve oxygenation to the tumor environment.
And better blood flow also theoretically means that systemic chemotherapy drugs can be delivered more effectively directly into the tumor bed. So looking back at the history, you can totally see why there was such massive hope that this mechanism was the silver bullet we had been waiting for.
Oh, absolutely. The early trials, specifically the BRAIN and BLOB trials, they generated incredible excitement in the medical community.
Because they showed a real measurable improvement in progression-free survival, right?
Right, which is the amount of time the patient lives without the tumor growing larger on their scans. The data looked so promising that the FDA actually granted accelerated approval for the drug back in 2009.
Yeah, the initial data undeniably shifted the landscape of neuro-oncology at the time. Progression-free survival at 6 months was significantly higher than historical controls, jumping up to over 40% in some of those early studies.
And when oncologists looked at the MRI scans, the visible tumor masses were shrinking dramatically.
And that clinical hope is completely mirrored in the patient perspective, even today. If you go to drugs.com and look up bevacizumab for glioblastoma, it holds an average rating of 8.3 out of 10.
Which is remarkably high for an oncology drug.
It really is. And reading the real-world experiences is just incredibly moving. One review stands out from a 32-year-old patient who had already gone through the grueling surgery, radiation, and temozolomide regimen. When the standard care stopped working and 2 new tumors appeared on their MRI, they started bevacizumab infusions.
And the results were fast.
Super fast.
Yeah.
Within just 2 months, they reported seeing dramatic improvements on their scans with side effects they described as minimal and totally manageable. There was another user who read that their mother's tumor completely resisted the standard treatments, but after just 4 bevacizumab treatments, the MRI showed the tumor had shrunk by 65%.
What's fascinating here is how exactly the drug is achieving that 65% shrinkage on the visual scan. This is where the underlying science takes a rather sobering turn.
Yeah, it does.
The 2025 medical guidelines we reviewed provide a harsh, necessary reality check for anyone looking at those scans. And that is, an imaging response does not necessarily equate to a clinical benefit.
That is a staggering concept to wrap your head around. I mean, if the patient and the oncologist are looking at an MRI and the tumor looks 65% smaller, how does that not mean the patient is actively beating the cancer?
It goes back to that leaky plumbing we discussed earlier. When the tumor's frantic, poorly constructed blood vessels leak, they constantly dump fluid into the surrounding brain tissue.
Right.
So when bevacizumab successfully normalizes those vessels and stops the leaking, it drastically reduces the volume of fluid and swelling around the tumor. Because that massive halo of swelling is suddenly gone, the physical mass appears significantly smaller on an MRI.
Oncologists refer to this phenomenon as a radiographic artifact.
Exactly. The actual underlying malignant tumor cells are often still very much present. They're continuing to silently infiltrate the surrounding healthy brain parenchyma. The massive Phase 3 trials, specifically the Avaglio and RTOG-0825 trials, definitively prove this.
They demonstrated that while progression-free survival improved, meaning the scans looked better for longer, adding bevacizumab to the standard treatment protocol did not extend overall survival.
It did not actually add days to the patient's life.
Which naturally leads to a profound question about medical intervention. If the shrinking tumor is largely a radiographic artifact, basically an illusion on the MRI, and the data clearly shows it doesn't extend the patient's overall lifespan, why are oncologists still prescribing it? What is driving that 8.3 out of 10 rating from the patients themselves if it isn't curing their disease?
The answer lies in the devastating mechanics of that brain swelling, clinically known as cerebral edema. The human skull is a rigidly closed, bony box.
It cannot expand.
It can't. So when those chaotic tumor vessels leak fluid into that confined space, it creates immense intracranial pressure. That pressure literally crushes healthy brain tissue. It is that secondary swelling, more so than the tumor mass itself, that causes many of the devastating neurological symptoms associated with glioblastoma.
Symptoms like the sudden loss of motor function, severe intractable headaches, rapid cognitive decline, and massive seizures.
Exactly. So by acting as a targeted microscopic master plumber and stopping those leaks at the source, bevacizumab drastically reduces the brain swelling. It pulls the pressure off the healthy tissue.
And that decompression brings us to what might be the drug's true superpower in the clinical setting, which is the steroid-sparing effect. To understand why that matters, we have to look at the traditional alternative. The standard medical approach to treating severe brain swelling relies on pumping the patient full of heavy corticosteroids, primarily dexamethasone.
And anyone who has dealt with long-term high-dose dexamethasone knows it comes with absolutely brutal side effects.
Oh yeah, we are talking about massive, uncontrollable weight gain, severe fluid retention, profound mood swings that can border on psychiatric breaks.
Rapid bone density loss.
Yes, and dangerous suppression of the patient's immune system. But because bevacizumab is so remarkably effective at reducing that edema on its own, it allows patients to drastically taper down or sometimes completely eliminate their dependency on those heavy steroids.
The reduction in corticosteroid dependency represents a massive victory for a patient's daily quality of life. In the early brain trial, half of the patients experienced significant, measurable alleviation of their brain edema. And the vast majority of those patients were able to cut their daily steroid dosage by nearly 60%.
Wow.
Yeah, when you remove the sheer systemic toxicity of high-dose steroids from a patient whose body is already failing, their subjective experience of life improves remarkably.
There's a review on drugs.com that paints a vivid picture of what that steroid-sparing decompression actually looks like in a living room. A woman wrote about her husband, who was suffering so intensely from the tumor and the associated swelling that he had lost almost all use of the left side of his body.
That's awful.
He was practically dragging himself across the floor just to use the bathroom. But then they administered his very first dose of bevacizumab. Within 2.5 days, the swelling had decreased so significantly that the pressure came off his motor cortex, and he was able to stand up and walk by himself.
Yeah, it's incredible.
The drug didn't cure his underlying cancer, but it literally gave him his mobility and his dignity back.
And that profound targeted effect on swelling and edema is exactly why bevacizumab remains a heavily researched tool today, even outside of trying to cure the cancer itself.
If you look at the European Clinical Trials Registry right now on clinicaltrials.eu, there is an active phase 3 trial underway that is completely rethinking the drug's application.
They are testing it specifically to treat cerebral radiation necrosis, right?
Yes. And cerebral radiation necrosis is a fascinating, terrifying condition on its own. It is severe, localized brain damage and extreme swelling caused entirely by the intense radiation therapy used to treat the high-grade gliomas in the first place. The treatment meant to save the brain ends up causing necrotic damage.
Right, and that European trial is directly comparing intravenous bevacizumab against standard oral dexamethasone over a 12-week period for patients suffering from that radiation damage. They are aiming to definitively prove that bevacizumab should be the superior first-line option for managing the symptoms of treatment-induced damage.
Primarily by relying on its ability to reduce edema without subjecting the patient to the awful compounding side effects of steroids.
Precisely.
Here's where it gets really interesting. Because while bevacizumab spares you from the horrors of dexamethasone, it is absolutely not without its own dark side. We're talking about a highly potent biological agent that systematically alters the vascular environment of the entire human body, not just the isolated brain tumor.
The brand new 2025 meta-analysis we reviewed provides a comprehensive, unvarnished look at those systemic adverse effects. Drawing data from thousands of patients across multiple studies, the average prevalence of adverse effects sits around 19%.
Now, many of those issues are relatively manageable in a clinical setting. Chronic headaches affect about 36.8% of patients. General fatigue is reported in roughly 24.1%.
But the severe risks hidden in that 19% are where the reality of manipulating human biology gets truly scary.
Yeah, the meta-analysis highlights gastrointestinal perforation, which is literally a hole forming in the wall of your stomach or intestines, leaking contents into the abdominal cavity. Then there is thromboembolism, which are dangerous, potentially lethal blood clots, sitting at a 4.17% prevalence rate. But why does cutting off the VEGF signal suddenly cause the patient's blood to start clotting dangerously?
It comes down to the fundamental role VEGF plays in a healthy body. VEGF doesn't just grow new vessels, it maintains the integrity of the endothelial lining, the smooth inner wall of your existing healthy blood vessels. So when you introduce bevacizumab and strip away that VEGF maintenance signal systemically, those healthy endothelial linings can become damaged or inflamed. This exposes the underlying collagen layer in the blood vessel.
And when your circulating platelets detect exposed collagen, they treat it like a traumatic injury.
Right, exactly. They immediately trigger the clotting cascade, leading to severe thromboembolisms.
Okay. There is also the terrifying risk of severe hemorrhage. Messing with the structural integrity of blood vessels can lead to catastrophic bleeding. Another drugs.com review we analyzed shared an absolutely tragic story.
Yeah, this one was hard to read.
A woman's husband was doing incredibly well initially, regaining his function. But around his 8th infusion, he began experiencing nausea and vomiting. By his next dose, he threw up a massive amount of blood. His vascular system had become so compromised that he couldn't even take a sip of water without actively hemorrhaging. He was rushed to the hospital and passed away the very next day.
It is a stark, heartbreaking reminder that this drug walks a razor-thin line between miraculous symptom relief and lethal vascular toxicity. It is a profound, ever-present risk.
And on top of that, the tumor itself does not simply accept being starved of its blood supply passively.
No, it fights back through an evolutionary process called acquired resistance. When bevacizumab successfully cuts off the localized blood vessels, the tumor becomes highly hypoxic again. But instead of dying from oxygen starvation, this suffocating environment triggers a biological panic switch deep within the tumor cells.
They undergo a transformation, shifting into a highly invasive, aggressive state known as a mesenchymal phenotype. But what does that transformation actually look like at a cellular level? How does a tumor cell change its phenotype to escape the drug?
The cells literally change their genetic expression and physical structure. They lose their cellular adhesion.
The biological Velcro that keeps them clumped together in a solid mass.
Exactly. By shedding that adhesion, they transform into solitary, highly mobile cells that can easily slip through the extracellular matrix of the brain. They shapeshift to become far more invasive, migrating deeper into healthy brain tissue to find new, pre-existing blood vessels to feed on.
They even start sending out chemical flares into the bloodstream, traveling all the way down to the bone marrow to recruit pro-angiogenic cells, pulling them up into the brain to help build alternative vascular pathways that bevacizumab cannot block.
And this insidious shapeshifting is exactly why the 2025 guidelines explicitly state that continuing bevacizumab after the tumor has started growing again is medically futile. The tumor has learned how to biologically bypass the drug's mechanism.
Yet, inside all of this intense data, there is one mind-bending paradox that completely flips logic on its head. We noted earlier from the meta-analysis that hypertension or high blood pressure is one of the most common side effects, hitting almost a third of patients, about 32.7%. Logically, you would think developing high blood pressure from a cancer drug is a bad sign, a marker of dangerous toxicity. But the research reveals something wild.
The hypertension paradox is one of the most fascinating biological quirks in modern oncology. The data clearly shows that patients who develop hypertension after starting bevacizumab actually demonstrate a statistically significant improvement in overall survival compared to patients whose blood pressure remains perfectly normal.
How does that make any sense? Why would having high blood pressure suddenly mean you are going to survive longer?
Again, we have to look at the baseline function of VEGF in the healthy body. In normal physiology, VEGF promotes the production of nitric oxide in your blood vessels. Nitric oxide is a powerful vasodilator. It keeps your blood vessels relaxed and wide open, which keeps your blood pressure low.
Ah, okay, so when bevacizumab aggressively binds up all the VEGF in your system, nitric oxide production plummets.
Yes. Without it, your blood vessels constrict and clamp down, driving your blood pressure up. Therefore, if a patient develops severe hypertension, It is a definitive systemic signal that the drug is actively circulating at highly effective concentrations and is aggressively neutralizing VEGF everywhere, including at the tumor site.
It serves as a bizarre, counterintuitive biomarker of clinical success.
Exactly.
So what does this all mean? We have a drug engineered as a microscopic interceptor to stop blood vessel growth. It drastically reduces massive swelling, physically fooling our most advanced MRI machines into showing a shrunken tumor.
Right.
It doesn't actually cure glioblastoma or extend overall survival, but it gives paralyzed, suffering patients the ability to walk again by replacing toxic, heavy steroids. It carries the risk of fatal hemorrhages, forces the tumor to shapeshift into a more invasive state, and might just give you high blood pressure as a weird backward sign that it's actually working.
It means that bevacizumab serves as a masterclass in the immense value of palliative care. In the field of oncology, the natural inclination is to focus heavily on the cure measuring success strictly by overall survival and extending the literal clock of a patient's life.
Sure, which makes sense.
But for a patient facing a terminal, wildly aggressive diagnosis like glioblastoma, preserving their neurological function, maintaining their mobility, protecting their cognition, and ensuring their dignity for the time they have left is an immeasurable, profound victory. It controls the devastating symptoms when every other option fails.
It fundamentally reshapes how we view success in medicine. Success isn't always about extending the length of the timeline. Sometimes true medical success is about radically improving the quality of the time that remains for the patient and their family.
If we connect this to the bigger picture, it is crucial to recognize that a drug's efficacy is entirely dependent on the specific context of the disease. While bevacizumab does not extend life for primary glioblastoma, the 2025 guidelines point out that for patients battling stage IV non-squamous, non-small cell lung cancer who have treated stable brain metastases, adding bevacizumab to their chemotherapy regimen actually does safely help extend overall survival.
Wow. So the origin of the tumor, its specific biological makeup, and its location change absolutely everything about how the drug performs.
Absolutely everything.
It is a powerful reminder of how hyper-specific these targeted therapies really are. Before we wrap up this deep dive, I want to leave you with a thought to mull over. We just spent this time exploring a drug that can literally change the physical environment of the human brain so drastically by sealing up leaky blood vessels and draining away massive fluid reservoirs that it fools our most advanced, state-of-the-art MRI machines into seeing a cure that isn't really there.
Yeah.
It makes you wonder what other profound, invisible biological changes are happening inside the human body right now, reacting to our environment or our medicines, that our current technology simply hasn't learned how to measure yet.
It is an incredibly humbling thought. It reminds us that no matter how advanced our imaging capabilities and diagnostics become, we are still essentially looking at shadows on the cave wall. There is always a deeper, more complex layer of biology waiting to be understood.
Thank you so much for joining us on this deep dive. Keep questioning the world around you, keep looking beyond the surface of what the data shows, and we will catch you next time as we unpack another fascinating topic.